Hi, my name is Katy Ransone. I'm a physical therapist with Center for Elders Independence, and I'd like to show you a few exercises you can do at home to maintain your strength and mobility. So the idea is you can do these exercises first thing in the morning when you wake up. So we'll start lying in bed. In order to lay down, what you want to do is lay onto your side while at the same time bringing your legs up, and then you can roll onto your back. So the first exercise I'd like to show you is called a bridge. In order to start this exercise, bend your knees and put your feet flat on the mat. And you want your feet a comfortable distance from your bottom. So if you experience any discomfort in the knees, you can bring the feet forward a little bit. So in order to start this exercise, tighten your abdominals and lift your hips up off the mat as high as they can go. Count for 1, 2, 3, and slowly lower. So again, tighten the abdominals, lift the hips up off the mat as high as you can go. Count 1, 2, 3, and slowly lower. Now do as many repetitions of this exercise as you can while maintaining good form. If you find that you can't lift your hips up quite as high, then you should stop. Okay, so that's the first exercise. Now the second exercise I'm going to show you is called clamshells. So for this exercise, roll onto your back to a comfortable position. Make sure your hips are stacked and your knees and feet are together. So for this exercise, I'm going to keep my feet together and lift the top knee up towards the ceiling as high as it can go while maintaining your pelvis neutral. And slowly lower. Lift up, count 1, 2, 3, and slowly lower. Lift up. Again, I'm not rotating my pelvis back. I'm keeping my hips stacked. And slowly lower. And then we'll do the other side. Feet together. Top knee lifts up towards the ceiling. Count 1, 2, 3, and slowly lower. Lift up. Count 1, 2, 3, and slowly lower. Now, if you have an exercise band at home like this one, you can also add it to this exercise for additional resistance. So tie it in a double knot, so you have it in a loop like this, and then you can either cross your leg over to put it through, or bend down as long as it doesn't cause any discomfort in your low back. Okay. Put it around your knees, and then we'll lie down. Onto my side, legs come up together. Okay, so we're in the position with our knees bent, stacked, hips stacked. And same thing, knee lifts up towards the ceiling, count 1, 2, 3, and lower. And again, do as many repetitions as you can while maintaining good form. If you find that your leg isn't lifting quite as high or your muscles start shaking, then stop. Okay? And now we'll do it on the other side. Okay. Knees together, feet together, hips stacked. Top knee comes up. Count 1, 2, 3, and lower. Up. 1, 2, 3, and lower. Okay. So, you can take the exercise band off. And then I'll show you one more exercise. This will be a stretch for your lower back. So for this exercise, you're going to begin by grabbing behind your knee and bending it in towards your chest. I have my other knee bent right now, but if it's comfortable, you can also straighten this knee out. And then you want to keep your shoulders, your upper back, and your neck relaxed, and take some deep breaths. You should feel a nice stretch in your lower back. If you feel any discomfort with this activity, stop immediately. Okay, and then we'll do the other side. Grab behind my knee, gently pulling towards your chest. Keep the upper back, shoulders, and neck relaxed, and take some deep breaths. And you're going to hold for about 30 seconds to 1 minute, and you can repeat 2 to 3 times. Okay, now for getting out of bed, the first thing I'd like you to do is bend your knees and put your feet flat on the mat. And then we're going to roll onto your side, reach your arm over for the edge of the bed or a bed rail. And then you're going to push into your elbow while at the same time putting your legs off the mat while keeping your back straight. Okay, those were some exercises I hope you enjoy, and you can do these once to twice a day. Thank you.